With the violence and aggression that's rising, it's actually made me think about leaving working in the healthcare field. And just even having the 4 hours with Gracie Medical Defense, I just feel all that more confident that I do want to stay and that this is where I want to be.
My name is Sarah. I'm a social worker in the emergency department. I've experienced violence, inpatient cases. I've seen people get kicked, punched, bit, and I just think it's not fair. We shouldn't come to work and feel afraid.
I went into nursing to want to help people, to be at bedside, to be able to care. But I went into a desk position because I was afraid. I was afraid that I would get hurt.
I've had colleagues who got bit by, patients, slapped, pushed in the face. It's unfortunately very real.
73% of all workplace violence injuries sustained that require time away from work are committed against healthcare professionals.
Even though we signed up for this, yes, this is part of my job, but it's not part of my job to get hurt, right? So I have to protect myself that I can go home to my family.
So I think as it stands, policy isn't entirely clear about how we as clinicians can keep ourselves safe. The beauty of this system is that it puts us in a scenario where we no longer have to choose between keeping ourselves or the patient safe.
It's hard for someone to believe that you can have a form of effective self-defense and self-protection and also keep the patient safe. And that is part of why we're so excited to share this program with the healthcare community, because we know that it is possible.
Shall we?
I think we shall.
The medical defense technique that we learned today, all of them were very humane, they were very effective, they were very compassionate.
I've worked at UCI Medical Center for 36 years. When it comes to workplace safety, Gracie Medical Defense ranks at the top. I have never taken a class ever that has been this comprehensive and hands-on, and I've learned so much that I will take with me.
I was able to attend with some of my coworkers, and everybody just thought this was the most incredible experience. It really opened their eyes to how someone can stay safe versus constantly having that fear.
I think having the toolkit of the physical to back up your verbal de-escalation techniques, which Gracie Medical does, and it combines both those together, really allows you to be the most powerful in de-escalation that you can be.
We need to start with de-escalation. People think, oh, these are jiu-jitsu masters, they want to fight. No, quite the opposite. The more capable you are of physically protecting yourself in a violent encounter, the more safe and confident you feel in your physical ability, the more capable you are of de-escalating verbally.
The best verbal de-escalation comes from someone who's physically confident in themselves. And a lot of the times I feel like I've never been able to verbally de-escalate confidently because of the chance of it escalating to the physical side of it. Honestly, just doing the 4 hours even was very confidence boosting, I should say.
We have a patient who is a danger to himself. The goal, eventual goal is 4-point restraint. That's mission accomplished. You can start with any grip you guys want to hold however you want, and anytime you feel like you need backup, you need help, you can call for help. You guys ready? Go.
Henry, one of the instructors, laid on the stretcher. It started out with 2 men trying to hold him down.
They called for help right away. Then about 10 other people showed up, and it was honestly chaos. There was no control, no communication going on. So it just seemed like a complete chaos.
The question is, can we do it with fewer people? Here's the position that we would like to start in. Here. Go ahead, Alex.
You're so close.
Come on, Alex, we believe in you.
Bro, give it some love.
Oh, there it is. How's it comfortable here? You okay? Okay, can you breathe? Are you being strangled?
No, I'm good.
Okay, excellent. All right, Matt, come on in. All it took was us asking the right questions. How do we have jiu-jitsu, high-level, 100-year effectiveness, but done with no joint lock, no neck restraint, no diaphragmatic compression? None. You just witnessed a new technique that we invented. It's called the safe wrap. And we're set. Give them a hand, you guys.
With these Gracie Medical Defense tools that I learned today, it provided me the power to understand that I am in power. And it wasn't simply just defensively, it was also verbally. I learned a lot, and I'm gonna be coming back for more, and I hope UCI continues to offer it to their employees.
I find this program to be absolutely incredible. For the first time in my career, I feel like the hospital is finally taking my safety and the entire staff's safety seriously.
10 out of 10 would recommend taking this class. Very informational.
Yes. I've done CPI and I've done Gracie Safe Rep Medical Defense, and it's not comparable. It's way more beneficial than anything I've learned at CPI.
With Gracie Medical Defense, I don't feel like I have to choose between my safety and my job.